Many men believe that masturbation is harmless and part of a normal sexual wellness routine. However, recent studies suggest that certain habits may impact prostate health in the long term, especially when it becomes excessive or inappropriate behavior. The prostate, a small gland located below the bladder responsible for producing part of the seminal fluid, plays an essential role in male reproductive health. Although it is often neglected until uncomfortable symptoms arise, its health is directly related to sexual habits, diet, and the natural aging of the body. Research published in the Journal of the American Medical Association, JAMA, indicates that frequent ejaculation may be associated with a lower risk of prostate cancer as it helps eliminate potentially harmful substances from the gland. However, not all studies point to benefits alone. Research conducted by Harvard Medical School suggests that overstimulation of the prostate may trigger chronic inflammation, known as prostatitis, resulting in pelvic discomfort, a feeling of pressure in the area, and changes in urinary function. This inflammation can lead to persistent pain, difficulties in urination, and even impacts on sexual life, such as erectile dysfunction and reduced sensitivity. Male sexual health is often discussed in terms of performance, virility, and pleasure, but few men can consider the actual impacts of masturbation on the prostate. According to the Mayo Clinic, inappropriate sexual habits may be directly related to symptoms such as excessive fatigue, energy fluctuations, reduced physical stamina, and discomfort in the pelvic area. Experts indicate that when masturbation becomes excessive, especially when associated with pornography use and the constant need for intense stimulation, it can overload the prostate, resulting in inflammation and prostate fatigue. The prostate has an essential function in male health, producing part of the seminal fluid that protects and nourishes sperm, while there is medical consensus that regular ejaculation can contribute to gland health. The manner in which this occurs is also relevant. Studies from the Cleveland Clinic demonstrate that excessive pressure during masturbation as well as improper techniques can result in micro-injuries to the process, triggering a silent yet harmful inflammatory process. In the long term, inflammation may lead to increased sensitivity in the pelvic area, as well as uncomfortable urinary symptoms such as frequent urination and difficulty fully emptying the bladder. But where is the balance between excess and moderation? A study conducted by the National Cancer Institute suggests that men who ejaculate between 13 and 21 times a month may have a reduced risk of developing prostate cancer compared to those who ejaculate less frequently. However, the same study warns that forcing ejaculation excessively may lead to prostate fatigue and symptoms such as a feeling of heaviness in the perineal region, lower back pain, and discomfort. While urinating as men age, the prostate tends to naturally increase in size, a process known as benign prostatic hyperplasia, BPH. According to the American Neurological Association, certain habits can accelerate this growth, contributing to symptoms such as frequent urination, weak urinary flow, and the sensation of incomplete bladder. Emptying. Small adjustments in sexual habits, such as spacing out periods between ejaculations and avoiding aggressive stimulation, can help minimize these effects and maintain prostate health for longer. But how can you know if your prostate is already suffering negative impacts? Experts from Johns Hopkins University warn that signs such as pain during ejaculation, changes in semen consistency, pain while urinating, a feeling of heaviness in the pelvic area, and frequent urination may indicate excessive stress on the prostate if ignored. These symptoms can evolve into more severe conditions, such as chronic prostatitis and hyperplasia. The Brazilian Society of Urology recommends that any persistent discomfort effort be evaluated by a health care professional for accurate diagnosis and proper guidance to keep the prostate healthy. Some simple changes can be implemented. Medical specialists suggest adjusting the frequency of masturbation, avoiding excessive pressure during stimulation, and paying attention to any signs of discomfort. Regular exercise, maintaining a balanced diet, and reducing stress are also fundamental factors in ensuring good prostate health. Small adjustments in routine can make a significant difference in the long run. Prostate health depends on conscious choices and accurate information. If you've noticed warning signs or want to ensure a healthier future, start implementing these changes. Today, regular consultations with a urologist are essential for monitoring prostate health and preventing complications before they become severe. If you've made it this far, I'd love to hear your thoughts. Rate this video from 1 to 10 in the comments and let us know what you think of the content. Your feedback is essential for us to keep bringing you useful and relevant information. Don't forget to subscribe to the channel to keep receiving our updates. Thank you so much for watching and see you soon.